a lot of people have been sending us countless emails about the beaches. I know that this discussion just kind of started yesterday. What are your guys' thoughts? Where are we at? Has anything changed from yesterday, or is it still just kind of up for discussion?
Let's frame, the discussion. So the commissioners, we had a meeting yesterday to extend the emergency order. As part of that discussion, commissioners have heard a lot of concerned citizens on both sides of the issue, but particularly about whether or not we can open up people for recreational purposes that live on the beach, or people that want to recreate without, creating the situation that we saw with the spring break type environment. They also heard concerns about condo pools and stuff, where maybe you have, seniors that want to be able to do laps in the morning and exercise and use that for therapy. The real issue is that we've been working on data sets and looking at where we're at in this pandemic. We're looking at when we're going to reach our peak. We're looking at how long will that last till we're back down at levels that we're even at today. And so it was really a challenge to staff to be able to bring these data points together and have an informed conversation to where we can communicate with people when they can expect to see changes. But those changes need to occur based upon information on the ground. We cannot have a relapse. We cannot go backward and have the situation occur where people are coming down here now to where they can walk out on the beach, and all of a sudden we have large groups and we see community spread, something that we're trying very, very hard to keep from occurring. So it was the beginning of a conversation, and I think we'll have more of that on Thursday.
And Sheriff, is there any concern on your end as far as to how this would be regulated?
Absolutely. I think that the appropriate thing right now is to maintain the status quo. And as the administrator said, is that what people need to keep in mind is a few very important and succinct things. Number one is that we have not reached the peak. That means we're still climbing. Now, thankfully, we're not climbing as fast as we once were, but we're still climbing. We haven't reached the peak in the number of cases. We haven't reached the peak in the number of deaths, and we haven't reached the peak in the number of people in ICU beds. So as we're still climbing, and we're still going toward that peak, and we're still in the tunnel, that means that we shouldn't change anything, in my view. And I think from a management standpoint, from a regulatory standpoint, from an enforcement standpoint, is that we need to stay where we are. It would be about impossible to come up with some scenarios where some things were permissible and other things weren't. We've seen that challenge in across the board enforcement of the safer at home orders. And one of the things that we have strived to do, and I think successfully, and look, the reality is that we're irritating people on both sides, but that's the way it is. And so you got some people that are pro that are mad at you, and some people that are con that are mad at you. That's the way it works, and that's what we do. But we've been fair, we've been consistent, and to be fair is to be consistent, to be consistent is to be fair, and we have been equal in the application of it, and that's the way that it needs to stay. Keep in mind also is that we're only 10 days. Think about that. Only 10 days into the statewide safer at home order. That's not a long period of time. And a pivot point is coming up here at the end of the month where the governor, based upon the best information available to him and the data, will have to make a decision what to do with that safer at home order statewide. And I think that we just maintain the status quo, especially because we haven't hit the peak with anything, with cases, with deaths, with ICU beds, is we maintain that course until the end of the month when the safer at home order expires, and then the governor will decide what he's going to do, whether he's going to let it lapse, whether he's going to extend it, or whatever he's going to do with it. And then that's an opportunity for a consideration and a pivot point at that time.
Okay, so you're thinking, from what I'm hearing, more after the peak, then this is something that you think should be considered after the peak takes place, whenever that might be.
Yeah, I'd ask the question, is that if you haven't peaked, would you change anything? Is that you haven't peaked and you're still climbing and you still have new cases, and to the tune of about 1,000 a day. So we're still seeing a lot of new cases. So no, I don't think that we should make any changes. This isn't about looking back. This is about today looking forward. Again, should some of these measures be in place? That ship sailed. We don't need to have that discussion. What we need to talk about is where we are today, and we shouldn't undo anything at this point. I go back to is you don't finish 50% of the penicillin prescription. And once you decide to take it, you complete the prescription, you take the whole bottle, because otherwise what's going to happen, you're going to relapse, you're going to have a resurgence, it's going to come back, or at least has that significant potential. And that's the last thing any of us want.
And we know it's playing on people's patience, but you know, again, the sheriff just talked about the peak. That's not projected until April the 26th. Just a few days ago, that was April the 21st. So this is moving, and we're watching this, and we're tracking it daily. We're also watching what other states and how they're trying to reopen pieces of their economy, and they're well ahead of us. Yet they haven't done that yet because of the concern on that. When we look at that peak, it would be June the 1st before we would even be back to where we're at today. And so we need to look at these trends, and we need to be very careful about these decisions and based on conditions on the ground. And I do understand condo, you know, you have a small condo owner where they would go out and do laps in the pool, but I can show you a pool deck of another condo building where it's party central on a Saturday afternoon. So we need to be very careful, because with thousands of different situations throughout the county, and being able to police this and making sure that we have the right measures in place to keep the community spread from occurring, that's what's most important right now. This is a public health crisis. And we, like the sheriff said, need to not take our foot off the gas.
So Barry, I can assume that you, or do you agree with most everything that the sheriff said?
Absolutely, and we've had these conversations with the commissioners. The commissioners are wanting to have the conversation, and they're not wanting to do the wrong thing. They're wanting to make sure an informed decision, but they're wanting to talk about how do we communicate with people that are getting frustrated. A condo owner that wants to be able to walk on the beach for exercise, and we understand that. And so having that conversation is a good thing to have. We just need to make sure as we make these decisions, we have the data to support the decision.
Yeah, this all makes sense. And Sheriff, I wanted to ask you in relation to the whole reason that we're talking about this is kind of because the commissioners were worried about people being cooped up indoors. Have you guys still seen more of a rise as far as cases, like domestic cases in houses?
We're seeing a little bit of that, but we've all been worried about that. I've said that from day one of this thing and been concerned about it, and still am. I wouldn't say we're seeing a significant increase. We had a couple incidents over the weekend are very concerning as far as crowds were concerned, and some fights. But that's par for the course when you're in this type of an environment and situation. And reality is that we're probably going to see more of it. But that's what we have to address and what we have to deal with, and it's all balancing it out. So there is no perfect in any of this, and it is, as I said many times in many discussions about this, the balloon is just getting squeezed in different places, and that's a result of squeezing in one place. You're displacing it to someplace else, and it manifests in different problems. So, but we address it and we deal with it.
Can I ask what hotspots or what areas you saw like crowding issues?
There was a couple things in the Wellman area over the weekend where we had some problems, different areas of the county. Overall, to get specific to your question about domestics are up slightly, but nothing that is of concern. But you do see a little bit of an uptick. You do see an uptick in some of the crowds gathering because people are cooped up, late at night. But nothing that is, again, but I want to say this, is nothing that rises to some high level of concern, nothing that warrants a curfew, nothing that warrants, this is just the normal manifestations that you're going to see when you're in this type of an environment. So nothing that's a significant uptick, nothing that warrants any action. We just have to address it on a case-by-case basis.
Okay, and I know one of the spots that St. Pete Police Department told us like a week or so ago, one of their hot spots for crowding was Vinoy Park. Are there any specific parks or places that you really want people to avoid the crowding?
No, every place. Everybody just needs to avoid the crowds every place. Just do the right thing, act in a responsible way, and that's how everybody's going to help themselves and others put this behind them as quickly as they can. If people are bending the rules, twisting the rules, manipulating it, trying to figure out a way out, all they're doing at the end of the day is hurting themselves and hurting everybody else. Don't try and put that round ball in the square hole. Just do the right thing and follow the recommendations. And if they're quicker by everybody doing that than everybody trying to buck it. And that's really what it comes down to.
We all want the same thing. We want the beaches open. We want people to use their pools. We want, we're all in the same goal. The question is how to responsibly get there.
That makes sense. And so curfews, I know the sheriff mentioned that, and that was one of my questions here. I know Hillsborough County's implemented this curfew last night. Is that something Pinellas County is looking at doing?
No, from a policy standpoint, we've talked about it this morning on our policy call, the sheriff and I with Dr. Cho and others. That's not something we're currently looking at because we don't have those types of issues in large numbers. We're able to deal with the issues that we have. People are acting responsibly, and so long as that continues, there's really no need to go down, towards that discussion.
Okay, and Sheriff, you agree with that?
Absolutely. There's absolutely no need for it here in Pinellas. I don't support that at all.
Okay, and then face masks. I know Jane Castor is talking about potentially mandatory face mask. Thoughts?
Well, I think the biggest thing is to look at the national CDC guidelines on that. We talked about that again this morning, and kind of it gives you a little false sense of protection. I guess from a standpoint of every time you go out and you touch something and you touch your mouth, there's a risk there, and so if it prevents things like that, certainly we haven't had discussions on whether or not we should have some type of mandatory issue. I leave that to their judgment, over in Hillsborough. We haven't had that type of discussion.
And Sheriff,
Christy, one of the things you might want to do is you might want to pitch a story just on that, because I suggest that the absolute majority of people don't understand the whole masking issue. And I'll say this and try and be as succinct about it, is that you got one end of the spectrum, which are the N95 masks, and they will protect you from acquiring the virus. There's very few N95 masks out there, and they have to be form-fitted, they have to be worn properly, and that will protect you the greatest way possible from acquiring the virus. Everything else doesn't protect you from acquiring the virus. It protects you from the virus to others. And unfortunately, in the community, and people I see, people I talk to, and the messaging that I hear, is people are misinformed on that. Is they think by wearing a bandana, by wearing a KN95, by wearing a surgical mask. And my concern is that will lull people into a false sense of security, and they will take more chances and do more things and get closer to others, and will negate the social distancing that they are practicing now because they think they're protected by these masks. And that's, to me, there's a danger in that, because people need to be informed about what they are, what they're not, and what they're going to do for you and what they're going to do for others. Again, be clear about this. People that are wearing bandanas, people that are wearing cut up t-shirts over their face, people that are wearing surgical masks, people that have gone to Michael's Crafts and Joann's Crafts and those places and bought fabric and created their own cloth masks, and they're washing them and putting them in the washer at home. That is not going to protect you from acquiring the virus. It's going to protect others from you if you cough or sneeze from spreading the virus. And there's a huge, huge difference. So let's call it what it is, and let's make sure that everybody's eyes wide out, open, and fully informed as they're considering the masks and what they're going to wear and why.
that all makes sense. So I can assume that, that we're not considering that in Pinellas County, this mandatory mask thing?
No, right now, no.
Not at this time. Okay. Is there anything, I know you guys are chatting at noon with people on Facebook. Is there any big thing that you guys are expecting for people to ask about or that you're expecting to talk about?
I think it's kind of the same things that we're talking about here. We're looking at the curve. We're going to try to communicate with people to where they can understand the expectations, and we keep them informed as we track this. We want out of this as soon as everybody else, but we want to make sure that we're safe. And we don't want to drag this out longer than necessary by causing community spread that would continue this to, go throughout our community. So we want to make sure that we're communicating well, and we're going to continue to try to do that to where clear expectations, addressing some of the concerns. There's a lot of businesses that are concerned about some of the decisions that are made, and it's like, the governor made a decision, we have to implement it, and let's get through this period, and then we can readdress that and see where we're at and what next steps we take. And so the sheriff and I, we're going to continue to try to, do things like that, make sure we have clear messaging, and we can answer people's questions and concerns.